So this is the little room that we're renting at the moment, and for Saroj, this is all he needs just to look after the patients that we deal with at the moment. Right now we see about, on average, about 2,500 patients a year, and our sort of annual running costs roughly about £5,000 a year. That's sort of our budget, and from that £5,000 we pay for the rent of this place, we pay Saroj's his wages, and of course the free families that we support. So in a nutshell, the clinic is looking after 2,500 patients a year, costing us around about £5,000 a year. So you can do the sums yourself. It works out to about £2 per patient per year. What we really want to do, our long-term sort of objective, is to make sure that this clinic just goes on and on and on, and try and make it as self-sustainable as possible. For the first 10 years, we were relying on donations completely, and for the first 10 years, all the patients were supplied with free medication. But the last couple of years, the costs of the medicines have gone up. Our donations, the income from donations have come down. So a year or so back, we decided that for this clinic really to be, here for the long term, it needs to be able to support itself. So we've sort of been using a retailer for the drugs up in Darjeeling for the first 10 years, and we decided that by going straight to a wholesaler that we can save straight away 30%, and that saving goes towards helping the free families right now. So what we do is any donations that come in at the moment, we're putting that into a little kitty, and any emergencies that crop up at the moment, then we'll use some of that money to send people to hospital, that sort of thing. But really,
what sort of distance do you have to travel to get to your nearest either hospital?
Well, the main hospital is up in Darjeeling, so it's about a 3-hour ride from here.
Not a good ride.
Not
a bumpy
a
ride.
Especially when you're sick.
Yes.
But what the clinic has done is that it's been able to treat people at the very beginning of their particular illness. So people would come along with a cough and cold and get treated for that. Whereas before they wouldn't have any local access to medicine, so a cough and cold would develop into flu, develop into pneumonia, and all of a sudden you'd have to go to hospital, and everything will cost a fortune.
Yeah.
So that's sort of the main aim of the clinic, is to just do very basic sort of first stage treatment for the local population, and by trying to get it sort of generating its own income, we're hoping that it will just go on for,
Yes, self-supporting. Brilliant. Thank you, Andrew.